Welcome back to Living Well. We're here with Dr. Joel Lopez. Dr. Lopez, welcome to the program. Let's talk about your background, your specialty. What is age management medicine?
Age management medicine is the field of medicine that deals with the signs and symptoms of aging and how to reverse these processes as we age.
So you're like 20 years old, right?
I'm 43 actually.
So you don't look a day over 25, let's say.
Thank you.
Do you practice your own form of medicine?
Yes, I do. I believe that I have to be a good example so that I incorporate this dietary and lifestyle changes. And in fact, I do use bioidentical hormones as well.
All right. Well, let me tell you, Wellness Secrets video crews recently visited your office. Let's go inside and show the people.
Sure, thanks.
If it wasn't for Dr. Lopez, I would still be with those horrible migraine headaches.
Dr. Lopez really listened to me and asked me questions and really is interested in helping me in my overall health.
If it wasn't for Dr. Lopez, I would have an open heart surgery.
Is this our new client here? One of my passions in life is helping others, and I know it sounds cliche. However, being in the medical field, and in particular in the holistic field, I see people getting better if you treat the cause or the causes of their illness rather than just treating the symptoms. How did you feel after the first IV treatment? For me, wellness is not just the absence of symptoms or signs of illness, but the presence of balance and harmony among a patient's physical, mental, emotional, social, and environmental well-being. Give me 5. How are you doing? One of the greatest comments that I get is that I give my clients hope. I also give them options for a second chance in life. And this is not just by giving them dietary or lifestyle recommendations, but giving them encouraging words.
Except by coming to you, I feel a lot better.
It's not just me or them, but we're partners in healing.
Dr. Lopez, if it wasn't for him, I don't know. I really don't know what would I do. He's able to change people's lives from being miserable to being extremely healthy and happy.
I love that Dr. Lopez wants to treat my whole body rather than just put a Band-Aid on the condition or the symptom.
Well, you heard the patient say that they had migraines, might have needed open heart surgery. What are you doing to help these patients?
Well, we're trying to get to the root of the symptoms rather than just treating the cause or rather than just treating the symptoms. So I look into like nutritional deficiencies, toxicities, and basically getting to the root of the problem. For instance, if a person is depressed, regular doctor may give an antidepressant, but I would look into magnesium deficiencies or possible like mercury toxicity, because this could cause depression.
Yeah, and some of this can be hormone imbalances.
Yeah, exactly.
But aside, from addressing hormonal imbalances, well, what are you looking for beyond that?
Yeah, there are a lot of possible causes of aging, and besides hormonal imbalances, there's chronic toxicity, there's nutritional imbalances, as well as chronic inflammation. So we try to address all these issues, so that way we could get optimal results.
So you're about working on prevention instead of waiting for a cure. Why is that important?
Exactly. Well, based on statistics, 25% of the health care is spent during the last few years of a person's life. So it's better if we spend this money on preventing illness and having a greater quality of life.
And you're also about personalizing medicine. Why does this matter to your patients?
Well, my belief is that everybody's different, so my approach to one individual would be different from another.
So it's different, for instance, than going to a large hospital and is that in more like a factory setting, or are you able to bring it down to be like the bistro of this kind of medicine? Yeah,
well, basically, what we do is there's no one-size-fits-all approach. Yeah.
Now, we talk about anti-aging medicine. You see athletes, for instance, using human growth hormone to regenerate faster in workouts and be able to play better in some cases. How does HGH relate to your line of work, and what are we talking about there?
Okay. Well, there's a lot of politics involved in medicine, but if you basically just address imbalances rather than just giving this for improving performance in an athlete, then you should be able to give a person better service or give them better results.
Well, what are some of the success stories that we see with anti-aging medicine? What works for people in this regard?
I've seen a patient who had depression for years, and we found out that his testosterone levels were actually low. So rather than giving him antidepressants, just giving him testosterone actually lifted his depression and actually improved everything else, such as his sex life, his relationships, his body composition, so more muscle rather than body fat.
How much does sleep relate to this, getting the proper amount of sleep?
Yeah, sleep is essential because that's when you actually regenerate your body.
Okay, so it's not just a look at what medicines you might help provide, but it's sort of a shift in lifestyle that you work with patients on.
Yeah,
Is that
exactly.
basically what we're talking about here?
Yeah.
All right, hey, if you want to know more about the doctor's practice, well, please visit wellnesssecrets.tv. And if you want to check out Dr. Lopez's office in person and personalize an approach, if you want a consultation, do not hesitate to make an appointment by calling that number that you see on your screen. All right, coming up later in our show, we will talk to Marie Ortiz about a unique approach to fitness where you take it slow. Stay tuned. Doctor, thanks so much.